Hi, do you know what is the most searched query on Google? It's not IPL or Bollywood. It is, what is wrong with me? Yes, it's Google before doctors. But hey, do you really want to take the word of someone who may not know any better than you and me? Hi, I'm Vineetha Athrey and I'm a journalist and an author. And I welcome you to Mallige Answers, where I catch up with renowned doctors from Mallige Hospital to answer questions on health and well-being. Join me. Hello and welcome to Mallige Answers. This is Vineetha Athrey and I am in conversation with renowned gastroenterologist Dr Dheeraj Karanth. Hi doctor.
Hello.
Doctor, we've all heard of these horror stories from friends, relatives, where somebody seemingly normal suddenly develops this numbing pain in the stomach and especially in the gallbladder, like that kind of a region, and very sharp pain, debilitating pain, and turns out it's gallbladder stones. What is this whole mystic gallbladder stones and how do they form? What causes them?
Gallbladder stones are produced because of multiple reasons. There is not a single reason. It could be your genetic background, it could be where you are ethnically from. All these things play a role. Hormones in the body, more common in women in a certain age. So there are many reasons why gallstones form. But let me tell you the secret. If you find somebody with a gallstone and they have picked it up on a routine ultrasound, you don't need to treat them.
Really?
Yeah, you don't need to treat them because the chances that it will cause pain in the next entire lifetime of the patient is very less, or it causes problems is much less. Although it has been associated with gallbladder cancers, it is not one of the reasons for which we remove the gallbladder, because the association with cancer is much less than the risk of surgery.
Okay.
So you don't do anything to a gallstone which is silent. But if the gallbladder stone causes pain even once, then it needs to be removed, because once it starts troubling, the probability that it will start troubling again and again or lead to complications like a pancreatic swelling or a block in the bile duct causing jaundice is pretty high. And it's a straightforward surgery nowadays with the laparoscopic technique. It's a 45-minute surgery and people come out by day 2 and then go home.
But you're talking about surgery. Is there a way that gallbladder stones can be treated without surgery?
Again, a big no.
Oh, really? Okay.
No. Yes, if the stone has slipped down and if the patient is lucky to have a single stone, it has slipped down into the bile duct and blocked the bile duct, you do an endoscopic therapy called ERCP and remove that stone. If there are multiple stones, after this procedure, patient has to undergo a laparoscopic cholecystectomy. The gallbladder has to come out in toto, not the stones. The gallbladder has to come out. So the next question that patient asks me is, doctor, do you think I can live without a gallbladder?
Exactly.
So you can live without a gallbladder. Gallbladder does not produce bile. It only stores bile. So the same bile is stored in the intestines.
If you're not getting it removed through surgery and you're living with that stone,
If you don't
does
have
that
pain,
cause any complications?
no. The only probability is in distant future it may cause some cancer. May. It may be 1 in a million. So for that reason you don't have to worry. You just leave it alone.
But is food a trigger for this? Is there any particular, I know that tomatoes are very strongly linked with kidney stones, but similarly are there any other foods that are associated with causing?
Well, honestly no.
No?
Honestly no. No food is related to causing gallstones. Gallstone disease can happen to a person who is genetically predisposed, who has the hormonal changes required, who may have a small component of lifestyle, but we don't know what exactly causes it to form or not causes it to form.
You mentioned lifestyle. What are the lifestyle triggers, possible lifestyle triggers?
No, we don't know. We don't know. Good lifestyle with a good exercise, about 30 to 40 minutes, 5 days a week, a healthy diet with a lot of vegetables and fruits would help these people probably develop less of gallstone related.
So if someone has been identified as having gallbladder stones, is there something that they need to do proactively in order to prevent that from becoming a problem?
They should be aware that they can develop pain which starts in the center of the upper abdomen and very intense. Whenever especially you are traveling, you develop a pain. you should tell it to the doctor whom you meet in whichever city you are that you have a gallstone and that's causing pain probably now. Yeah, other than that, I don't think proactively they should do anything to take care of the gallstone.
In how many cases are gallbladders removed, and is there some
No,
statistic?
anybody who develops, no, I don't think I know the numbers there, but anybody who develops pain needs the gallbladder to be removed. And although it's a simple surgery, the learning curve is quite steep, and people who need to do it more often to get the hang of these things.
What are the potential complications associated with surgery?
Well, they can block the bile duct sometimes, the edema, it can cause jaundice again, it can cause leaks of the bile and infection and anesthesia related complications. They are all dangerous. You should probably do it in good hands and in a good center which can handle it, and most importantly you should do it only when it is required.
And dangerous enough to be fatal, or is it?
Yes. Yes.
And let's say if a person has had his or her gallbladder removed and is living without a gallbladder, is it a smooth ride from that point on, or does it mandate some lifestyle changes?
Few people would develop a little diarrhea which would resolve in about a few months or up to a year, but lifestyle would have no role to play here.
Thank you very much, doctor. Keep watching Mallige Answers. We are discussing gastrointestinal disorders.